Hi there, it's Dr. Green with Regen Suppliers, your source for everything regenerative. Today we're talking about the Emcyte PurePRP system. I'm going to go through all the steps involved in a double spin with pictures and my awesome voiceover. Now, Regen Suppliers offers the Emcyte system along with centrifuges and the kits. If you want to visit us at regensuppliers.com, you can also call us at 888-568-6909. All right, so when you use the PurePRP system from Emcyte, you will need to use, one of their centrifuges, and we offer two of them. I'll show them to you in a moment. But this is what the kits look like of the 30 ml variety, PurePRP 2. Now, there is a 20 ml system as well, which we offer, but it is not meant for a double spin. Okay, so the 30 and the 60 that we offer are what's meant for the double spin, and we'll go through what to use. The kit is all-inclusive, so it has everything in it that you need for the absolute most part. Hot tips: swab everything with an alcohol swab. Even if the kit comes sterile, you should still use the alcohol swabs in the kit to swab the plastic devices, everything, before you stick a needle through them. Don't forget the anticoagulant. You don't want to end up with clotted blood while you're trying to perform PRP. Make sure you counterbalance. You don't have to be, 100% counterbalance. You can have a little bit of off, but you don't want to ruin your centrifuge by forgetting to put the counterbalance in there. And then label the blood. Nothing worse than having a few patients in your office getting PRP, you forget to label, and you end up giving the wrong PRP to the wrong patient, right? So make sure you label everything. All right, so the first thing you want to do is add the 5 milliliter of the anticoagulant that comes in the kit to the 30 cc syringe, and that's in the kit too. So you can see here the 30 cc syringe. So you're going to add 5 cc's of the anticoagulant. Then you're going to do a blood draw. It comes with a butterfly needle, and you do a blood draw like you normally do. You pick the arm, just like if you were at the lab. Now, once you have the 30 cc's in the syringe, the 5 of the anticoagulant and the 25 cc's of whole blood, then you're going to inject the blood into the tube with the blue top and the CURVY tubing, okay? Now, before you say, well, they both have blue tops. I know that. Okay, you can see the other one has a blue top too, but this one has the CURVY tubing. The other one has straight-ish tubing, okay? So use the one with the CURVY tubing. And make sure you swab it, like I mentioned before, and then inject it all into the tube. All right, now you want to weigh the resulting tube of blood, okay? When you buy a centrifuge and a starter kit from us, it does come with a weight, a scale. You can buy one separately if you want a second one, but the one that comes with it is great. All right, so weigh that, and then put together a counterbalance of the same weight. So the counterbalance, just put water in it. It's fine. You're not going to use that for anything clinical, and then just get it as close as absolutely possible so that you don't ruin the centrifuge. Now, put the tubes in the centrifuge across from one another, right? That's the definition of counterbalancing. And as far as the centrifuge goes, there are 2 that we offer. This one is called the Platinum centrifuge. I think I have a better picture of it here in a second. Yeah, here we go. The Platinum centrifuge is pre-programmed. It's really, really, I guess the term would be idiot-proof. But it's just simple, You're really going to be doing one spin and then a second spin, and you just put it in there. First spin, hit the start button, and it does it for you. There is also an Executive Series centrifuge, which is, about $750 more or so, but it's just 30 pounds more. And we sell a lot of them, but it's not necessary for most practices. All right, set it on spin 1, push the start button. Spin 1 is only 1 minute, okay? And when it comes out, now remember, it's 1 minute, but it takes a while for it to actually stop spinning. So that'll take another minute or 2. Okay, so when you bring it out, this is what you'll see. You'll see the tube now has been separated into 3 layers. The top coat, which is the plasma, the middle coat, which is what you really want, the buffy coat, and that's where all the PRP, most of the PRP is, and the bottom layer, which is the red blood cells, okay? You don't really want the red blood cells. That can be harmful to the healing process, so we're going to actually not use that. We want the middle layer and some of the plasma. Here's a better look at it. You can see this haziness with a little pink in it. That's the buffy coat, okay? Now, so what you're going to do is you're going to use the other syringe in the kit to draw off the top two layers, okay? The plasma and the buffy coat. When you get down to seeing a tinge of red or pink come up into the syringe, that's when you want to stop. You want to minimize the amount of red blood cells you get into this second syringe. Yeah, so stop once you reach the red blood cell layer, which is pretty much where this person is. All right, then you're going to insert from the syringe into the second tube, and this is the one with the straight tubing, okay? And it should look like this. Maybe a little more pink if you got some more red blood cells in, but you get the idea. Now, counterbalance, again, like Freddie is doing here. Please don't forget that. And once again, you know, swab everything with an alcohol swab as you do all this. And then you place the tubes across from each other, once again, into the centrifuge, and you push the button for spin 2 on the Platinum series. In the Executive, you have to actually program it, but the second spin is 6 minutes. Okay. Now, after the second spin, the platelet poor plasma is going to be on the top, and the platelet-rich plasma is going to be on the bottom. All right. So this is the PPP, and it's hard to see it, but the platelets have stuck to the bottom. Okay. Let's see if I got another shot here. No, I don't. So here's the technique. Draw off most of the PPP. Okay, not all of it, just most of it. You know, it might end up being around 5 cc's if you used a 30 cc kit, maybe a little bit more, but don't go all the way to the bottom. You see how, you know, Freddie's leaving a few cc's here? What you want to do is leave some at the bottom to then swirl it around so that the platelets unstick from the bottom of the tube and suspend themselves. All right, and then that is going to be your PRP, okay? So with these two final syringes, you have this one with the PPP and this one with the PRP, okay? The platelets are going to make the that syringe a little bit darker. So here's the final result. PPP in the bigger syringe, okay? And then the PRP in the last little 12 milliliter syringe, all right? So you can use those for your various applications. Now, the PPP is not useless. It does still have a lot of nutrients in it, some hyaluronic acid, some things that are really helpful as well. So, you know, a lot of protocols will use PRP for the injections and then maybe some PPP on top of, say, the hair, and then you microneedle that in, okay? So it can be helpful as well. All right, Regen Suppliers is really a one-stop regenerative shop. We offer all the Emcyte centrifuges and the kits. In addition, we have a full slate of regenerative biologics that includes amniotic, umbilical cord, tissue, and blood. Exosomes, we have amniotic-derived, we have MSC-derived. We offer a full line of aesthetics products, microneedling devices, PDO thread lifting, and there's just more. We have cryogenic freezers, pretty much everything you would need for your regenerative practice. You don't have to go to all these different vendors. We have great pricing. We have a rewards program. We also offer marketing and training if necessary. So visit the website today at regensuppliers.com. Sign up for a membership. It's free, and you'll get regular specials and discounts sent to you. We offer new member specials, which you can see on the website as well, which are great packages. All right, thanks for watching.